L'humanité a vu le monde en Afrique et l'avenir du monde se jouera en Afrique, c'est une certitude. Ceux qui se trompent de carte dans ce sens-là se trompent d'histoire et surtout se trompent d'avenir. Quelqu'un avait dit un jour, celui qui saura mener l'Afrique vers le haut contrôlera le monde. Je pense que l'Afrique est en passe de contrôler le monde dans le bon sens. Je donne la parole à Madame Tindey pour nous lire les recommandations.
Thank you very much. Your Excellencies, distinguished guests, dear friends and colleagues, again, all protocols observed. I am here today to live up to the promise I made on Wednesday, a few days ago, to prepare a declaration for this conference that we will call the Marrakesh Declaration. However, before reading, I must emphasize that this is a living document that is in no way cast in stone. It is a living document that will be edited when new evidence is available. This initiative in Morocco to construct a declaration is of critical importance, as we cannot wait for anyone else to be the architect of our future realities. We must document and formalize our deliberations and aspirations with a commitment to action-based outcomes. Because it is us that must build our future. Africa must lead. There is no one else. With that being said, I will read the declaration as, I emphasize again, a living document, not cast in stone. Marrakesh Declaration on Health Risk Reduction in Africa. We, the participants of the first African Conference on Health Risk Reduction, met on November the 16th to deliberate on health risks which include all hazards and risks to health that are beyond the control of individuals and thus fall under the responsibility of public authorities. The conference focused on health risk reduction as a strategy to improve health systems on the continent in terms of accessibility, quality, and affordability. With over 800 senior-level participants from Africa, the Middle East, Europe, Asia, and the Americas, including government officials, health practitioners, scientists, researchers, media representatives, and civil society, the conference was a preeminent gathering of minds committed to improving quality healthcare delivery for all in Africa. Aware that in this post-pandemic context, when humanity has reached the 8 billion mark, accessible, quality, and affordable healthcare is key to reach the United Nations Sustainable Development Goals, SDGs, in general, and goal number 3, good health and well-being in particular. Cognizant of the need to assess and evaluate health systems in relation to innovations, digital inclusion, financing, policy reforms, social considerations, and others, as well as the need to build a healthcare community that embraces multi-sectoral consultative inclusion in order to bring about healthier societies where the dignity and health of all African citizens is preserved. The 3-day program created a multi-dimensional and interactive platform that connected a large number of expert stakeholders in enriching exchanges. Concerned by the lack of adequate resources, often poor infrastructure, low health literacy rates in the global south, and on one hand, the stigma, barriers, and low level of cooperation from richer countries as witnessed during the COVID-19 pandemic, on the other hand. Responded by sharing and debating interventions that can form a basis for a new framework based on multi-sectorial collaboration for carrying out scientific research for the development of evidence-based policy and regulatory guidelines that could prevent or reduce health risks and ensure health security and protection for all citizens with equitable access to quality healthcare in Africa. Deliberated on strengthening health systems in Africa with an emphasis on government's responsibilities as well as financial sustainability models and use of new information and communication technologies to accelerate digitization, the emerging medical cannabis therapy, and the social determinants of health, including the silent killer diseases, mental health, and addictions. Believe the health risk reduction approach focused on patient citizens' human right to healthcare has the potential to be an effective public health strategy that can reduce harm whilst lowering the health burden, especially those associated with non-communicable diseases, and help reach the ambitious global target to reduce NCDs by 25% by the year 2025. Acknowledge progress made by governments that are starting to embark on difficult but necessary road towards setting up universal health coverage in national systems that mandate the reduction of harm as a priority wherever possible and strive to reduce territorial and socioeconomic inequities in the quest to include all citizens based on the values of humanism and solidarity, and mindful of the pressing need for African countries to work together collaboratively to define a collective, integrated, resilient African health system and share best practice to provide health security and quality healthcare for all on the continent. The conference made the following recommendations. 14 recommendations I will read to you now. Recommendation 1. To promote the strengthening of health systems on the African continent using a health risk reduction approach. 2. To elevate the daily living conditions of all citizens by improving the environment in which people are born, grow, live, and age through health systems transformations and ethical harm reduction strategies and risk-reducing innovations for known health risks. 3. To develop healthcare policies in Africa that are focused on providing universal health coverage to the patient citizen and respect equitable access to quality healthcare as a basic human right. 4. To promote social protection mechanisms and ensure access to quality assured and affordable essential health services, including pharmaceutical medicines, traditional and natural medicines. 5. To present and learn from COVID-19 response strategies as examples in implementing an efficient, collaborative, and resilient healthcare system in Africa. Recommendation 6. To accelerate the implementation of the primary healthcare vision and strategy to expand telemedicine and the use of digital health to serve remote and vulnerable populations. 7. To improve access to quality mental and psychiatric care in line with the development of knowledge and treatments as well as the specific needs of patients in relation to their age, socioeconomic situation, environment, and vulnerabilities. 8. To recognize addictions, both substance and non-substance related, as diseases that qualify for medical attention. Recommendation 9. To promote education for healthier living, including physical activity, healthy diet, and risk-reducing lifestyle choices. Excusez-moi. 10. To increase health financing through innovative and sustainable funding mechanisms, including public-private partnerships, increase allocation of domestic resources, and welcome global solidarity. Recommendation 11. To promote medical cannabis as a new controlled treatment for specific symptoms and diseases and set up ethical guiding principles to regulate medical cannabis in order to implement it as a risk reduction measure. 12. To recognize that the field of digital health, including robotics, regenerative medicine, artificial intelligence as well, represents an opportunity for developing and strengthening African health systems by lowering barriers such as cost, accessibility, or lack of quality care, whilst expanding the range of services provided, particularly in areas where infrastructure and medical personnel are scarce or non-existent. 13, to develop an African health risk reduction charter based on a multi-stakeholder vision of health risk reduction as a key approach to sovereign health system transformations in an African environment that favors solidarity and cooperation in providing health security for all African citizens. And finally, recommendation number 14, to hold an annual conference to ensure continued and accelerated efforts towards improved universal health coverage for all on the African continent. I thank you.
Thank you, Mrs. Tinde, for this